If we want to end AIDS, and we can, we have all the means, that means focusing on and working with the populations that are most affected. And that's the essence of Bridging the Gaps. It's a program that works with and for key population communities to in an HIV response, but linking health and human rights in all the programming.
There is one thing with Bridging the Gaps program that makes it unique and really excellent, because it's one program that can be described and communicated to people pretty easily, but it really gives the whole context of HIV response and the difficulties we are facing. Because in one program it brings 3 different populations, it brings the different layers like local, regional, global.
The name speaks volume. Without the gaps being filled and identified, the communities are dead. Such a program is really important, effective, because the communities are able to identify with the stakeholders that they work with. There's a new identified gap, so it's not fixed, it's quite flexible. It truly is bridging the gaps, as the name says.
Sex workers, people who use drugs, and LGBT people are key populations for a reason, and that is strongly connected with the lack of access that they often have to both prevention and to treatment and care in HIV. So percentages, prevalence among the key populations are really, really high. Up to 50% worldwide, and in some regions up to 95% of new infections are made up by key populations.
Bridging the Gap is really good in influence as a donor to more focus on the community and put the community in the center.
I think there's a lot of evidence, and we see that in Bridging the Gaps as well, that this works, that local communities feel much more engaged if projects are led by themselves, and the impact is much bigger.
I think it's important because these are our experiences, these are our lives, and we need to make sure that all interventions are acceptable, they're inclusive, and they are rolled out in a manner that are accessible to all of us without exclusion.
So we're here in Hanoi in the Bridging the Gaps Learning Institute, which is something that we do annually. We bring people from across regions and countries together to strategize together here, to work together, to learn from each other. It's important and it's effective to join forces, join voices, to have a stronger voice and to have more influence.
Working with other key populations made me much wider understanding of the problem and of the issue. I think what is really cross-cutting and clear is that wherever you criminalize, wherever you discriminate, it is so hard to get like health programs working out. So really understanding that makes it clear that unless you can bridge the gaps with these key populations, you won't have enough political power if you want to make things change, to make your voice heard.
Сегодняшнего дня меня впечатлила одна фраза. Это нужно быть чиновниками государственными на равных. Нужно понимать, что не мы от них зависим или они от нас. Мы в условиях партнерства, и мы должны работать как партнеры с ними.
For myself, I think I gain a lot of knowledge about the different models around the world and under Bridging the Gaps programs, and apply it in Vietnam, like sensitized care provider, like how we can mobilize a volunteer from community, and how we can sustain ourselves by organize the clinic and also service provisions.
Thì chúng tôi được nhận từ tài trợ của lấp đầy khoảng trống đó, thì chúng tôi là như là khi thuê một cái văn phòng để làm việc dành cho mạng lưới, và thêm nữa lúc đó thì chúng tôi nghĩ là mạng lưới phải cần có văn phòng, tại vì chúng tôi thường nói là có an cư thì mới có lạc nghiệp, là có, tất nhiên là cũng như là khi có văn phòng rồi thì mạng lưới mới an tâm làm việc để phát triển hơn.